My name is Margie Huff, and this is my evidence-based project presentation for the University of Kentucky. My practicum site was a homeless healthcare clinic. This was a very eye-opening experience. Although I have worked with community health for about the past 6 years, I had never worked with this homeless population. Also, I'm entering an NP program in the fall, so I was excited about this project. I wanted to educate myself on the role of a nurse practitioner serving the homeless population and how that varies from other specialties. Also, I wanted to develop some educational materials to teach my fellow BSN classmates about the current role and scope and practice of an NP. Also, common graduate school admission requirements, course loads, and clinical requirements for an NP program. My learning objectives for this project were to interview and observe my preceptor, who is an FNP, during my clinical rotation, to describe the current role and scope and practice of an NP, specifically in the homeless healthcare setting, and to develop a plan to educate my fellow BSN classmates on the current role and scope and practice of an NP, and to discuss admission requirements, course loads, and clinical requirements of NP programs. My plan was to work with my preceptor during patient consults and improve my understanding of her role, perform evidence-based research on current role and scope and practice of an NP, and also to gather that information on admission requirements and course loads and clinical requirements for NP programs. And lastly, to create a PowerPoint presentation for my fellow classmates on all of these topics. This homeless clinic offers free services to the homeless population in the community. In order to be considered homeless, you have to be living in the streets, living with a friend, or living in temporary housing. And they see all ages, from infants all the way to elderly. The clinic offers medical treatment, housing placement, case management, job placement, rehab, mental and behavioral health treatment, referrals to charity care for medical coverage, pharmacy, and therapy groups. So Charity Care is a nonprofit organization within the community that has set up funding for medical coverage for these homeless patients. And then the homeless shelter collaborates with physicians in the community who accept charity care for referrals. So for example, if a patient needs to be seen by a podiatrist, then if there's a podiatrist on the list that accepts charity care, they will be referred to that physician. They do not have physicians in every specialty, but they do have several. Also, the local hospitals will accept charity care as well. So if the patient needs a CAT scan or so forth, they can get that done at the hospital. They coordinate care with community organizations such as the Soup Kitchen that is located directly across the street, and then physicians and pharmacies in the community. Many of these patients are very ill. They have very low health literacy. They are physically and mentally handicapped. They are plagued with debilitating mental disorders and chronic diseases, drug addictions, and they often have no support system. They also have higher risk for STDs and have higher mortality rates. My nurse practitioner was providing truly holistic care to the patients that she saw. When a patient came in the door, for example, with a cold, she's not just treating the cold. Every single time she is treating the patient as a whole. She is doing a full assessment, full questioning. She's asking the patient where they slept last, what they ate last, what their regular diet looks like, what their sexual practices are. All of those things are very important each time they come in the door because they don't come in as often as they should. So you take advantage of the fact that they're there. One of my patients, for example, didn't know what medications he was on. It was his first time at the clinic, so she spent a lot of time calling the pharmacies. He said he went to a pharmacy up on the hill a couple streets away. So she called the pharmacies, found where he had picked up his medications, wrote down all of the medications so that she could provide him with his medications while he was there. They do a lot of community networking, a lot of building relationships in the community, and they spend a lot of time with each patient, much more time than I've seen providers spend with patients in the general population. These nurse practitioners are doing disease prevention and health promotion education with every single patient, talking about how to prevent diabetes and high blood pressure, etc. These patients are at a much higher risk for chronic diseases than other patients. They have a very high job satisfaction. The nurses discussed having feeling like they had a calling to treat these patients, a purpose in their job. And in general, nurse practitioners who work with community health do have a high job satisfaction. They're doing life coaching, advocacy. They are social workers and working as therapists. They assess, diagnose, treat, and manage care. They're humanitarians. They're fighting for equality. They, like I said, a lot of community networking. They are licensed independent practitioners. They order, conduct, and supervise diagnostic and lab tests. I saw a nurse practitioner do a pap smear, take some cultures, go into the lab, put it on a slide, look at the culture, and diagnose an STD. So I got to witness that and see that for myself, and that was pretty amazing. But they are doing this kind of work. They're performing procedures on a regular basis, such as wound care and debridement. They are prescribing pharmaceuticals. So all of these things are very important to the role of a nurse practitioner in the homeless setting. According to the American Association of Nurse Practitioners, they have been providing primary care, acute, and specialty care to patients over the past 50 years. This job title was originally created out of a shortage for medical doctors, and it has grown even more than expected over the past 50 years. As of August 2018, there were more than 248,000 licensed nurse practitioners in the U.S. alone. And according to literature, nurse practitioners should be assessing patients, ordering and interpreting diagnostic tests, making diagnoses, initiating and managing treatment plans, and which includes prescribing medications. And yes, that is exactly what is happening at my clinical site. These nurse practitioners are doing exactly that. They blend clinical experience in diagnosing and treating health conditions with an added emphasis on health promotion, disease prevention, and health management. And that is to the T exactly what is happening at the homeless healthcare clinic with the nurse practitioner that I was with. They definitely emphasize that health promotion, and they have to. These patients need education on how to take care of themselves, how to prevent diseases, because they are at a higher risk of many chronic diseases than the general public is. They practice prescription authority. Some states do require physician oversight, and some require a transition time, so they cannot prescribe initially, but then they can after a certain length of time, while other states are completely independent. So that's what we're going to talk about on the next slide. I'm going to show you a map and kind of talk about which states allow nurse practitioners to work independently and which ones do not. So if you take a look at this map, you can see that the states are divided into 3 different categories. The green are the states that allow nurses full independent privileges, so no restrictions on them. They do not have to be overseen by an MD. Yellow are the reduced states, so many of you are in Kentucky. This means that there is a transition time. Originally, when you first get your licensure, you do not have independent practice, but after a certain length of time, and that varies according to state, you can earn independence. And the last is the restricted, and that's where I am, the red, and that means that you always are overseen by a medical doctor. So it's commonly known that homeless patients do not have good access to primary care, and then once they do get into the system, they do not understand how to navigate it. So there have been some recommendations set forth. One particular article from 2016 recommended that we improve our primary care system among the homeless by strategies that include intensive case management, assertive community treatment, integrative primary care clinics where other services for people who are homeless are provided, such as mental health and social services. A fixed or mobile outreach, orientation of primary care clinic services, and housing and supportive services. So when I look at this homeless clinic that I visited, they are definitely practicing according to the best research that's out there. They have very intensive case management strategies. Every patient that comes in the door is seen by a case manager who is helping them accomplish lots of things like setting up appointments, following up with physicians, coming back in to pick up their medication. The list goes on and on. Assertive community treatment. Yes, this homeless clinic just moved to this site about 8 years ago because of the need to have the clinic right there among where the homeless are living. And then orientation to primary care services. Yes, when they come into the clinic, they're being shown around, introduced to everyone. They go to great lengths to make sure they understand where to go and what to do. And then housing and supportive services, which is definitely located right on site. Mental services, therapy, behavior services, all offered right there in one location. My practical experience was very enriching. I learned so much from my nurse practitioner and their holistic approach to treating these patients. They are doing very important sacrificial work, and they feel that they have a calling, a purpose in their lives to treat these patients, and they're doing it in a very, very kind and humble way, and while respecting these patients all at the same time. I enjoy the fact that they get to work with the community, with the nonprofits, in a very collaborative effort to treat these patients. They are very highly skilled. They definitely stay up to date on their research. If you ask my nurse practitioner any questions, she can tell you about the latest research on that topic and just about everything. And then I also appreciated the fact that they had several electronic databases that they use to look for information. So they are not required at all times to have every bit of information stored away in their brains. They actually use resources continuously to find the best evidence-based practice in every issue that they need to address with these patients. I was shocked by the amount of destitution found in this clinic. I had no idea that patients could be children and not be taken away from their parents when they are homeless, that they could live on the streets. In fact, I didn't know that there were so many physically and handicapped, mentally ill people who truly need to be in a home with someone else caring for them, living right on the streets. So for some of these people, they have no hope of getting a job. They're not physically capable of handling that. So it was definitely very unique experience. So now that you are in the last part of your BSN program, you could consider entering a MSN or a DNP nurse practitioner program. Let's look at NP defined by the scope of practice policy. They say nurse practitioners are advanced practice registered nurses, APRNs, who serve as primary care providers. They hold advanced degrees either as an MSN or a DNP, plus national certification in a patient population focus and a state APRN licensure. There are several specialties that you can go into. You can be pediatric nurse practitioner, neonatal, family nurse practitioner, adult gerontology, psychiatric, women's health, acute care, and emergency nurse practitioner. Many options, many course directions that you can go into when you're choosing a program. One thing to consider is, say I do an FNP program and I want to work in psychiatric mental health later, you can go back and get some certifications in those areas as well. So you can subspecialize in several areas if you want to continue on and earn those certifications. So if you're thinking about entering an FNP program, there are 4 basic steps. Number 1, earn your BSN. Number 2, become an RN and garner 1 to 2 years of experience. You can switch the order of those like I did, and that's okay. Number 3, pursue and earn an MSN or a DNP. Many schools are going towards the DNP format, but there are still plenty of MSN programs out there. If you choose to enter the MSN program, the schools can range from 1.5 years total all the way to 4 years. That just depends on the intensity of the programs. You can do these online or on site. Online programs require that you do your clinicals in your hometown. And lastly, after you earn your degree, you get certified by sitting for a test for local and national boards. The applications for these nurse practitioner programs are all very similar. First, you'll need a resume. Number 2, you'll need university transcripts. Then you will need 1 to 2 page statement of professional goals, 2 to 3 letters of recommendation. Interviews, sometimes those are online, sometimes they're in person. Proof of RN licensure. Some schools require GRE or MAT scores. The ones that I applied for did not. and there are often two applications, the institution application and the graduate studies application for each university in which you apply. And if English is not your primary language, you often have to take a test of English as a foreign language. Thank you for listening. If you guys have any questions, feel free to reach out to me. Thanks.